It has been said that you were a big fan of the consumer health business as sort of a way to offset some of the risks involved with pharmaceuticals. So the people are wondering whether you changed your view or whether the facts changed for the outlook for the industry. What makes this, what caused this change of heart, if you will?
Well, good morning, and thanks very much for having me on this landmark day for GSK, when we're announcing a deal that strengthens two business and creates significant value for shareholders. Actually, there's no change of heart here at all. I've been absolutely consistent since I took this job and laid out our priorities 18 months ago, that we quite like the broader construct of the business with pharma, vaccines and consumer healthcare. But there are always conditions to that, access to sufficient capital for each business, and also that the board would be pragmatic about the structure. And this opportunity is truly a unique one in an all-equity deal to create the world's leading over-the-counter drugs company, a leading consumer healthcare company with significant value creation for shareholders. But it also allows us to strengthen on our number one priority, our pharma pipeline, by the incremental cash flows over the next few years, and then gives visibility with this pathway to eventual separation after we've substantially delivered on the integration and continued to make progress as we expect in our pharma pipeline, thereby creating two focused UK-based global companies, one a pharma and vaccines company based on the science of immunology, genetics and new technologies, and then one, this new global leader in consumer healthcare in this joint venture that we've brought together with Pfizer, a partner we know well because of our joint venture also in the HIV business.
Previously, did it make sense for the cash generation of the more, I don't know if I call it more stable business in consumer health, that helped fund some of the drug development efforts? Do you feel more confident in the being able to predict what happens in the pharmaceutical development side of things than and I know vaccines that's a little bit more stable than that might take away some of the risk in developing. Yeah, go ahead.
That's exactly the right point. So you know, we have today three businesses: consumer healthcare, pharma and vaccines. We've been working very hard under new leadership. I appointed new heads of commercial and a new head of R&D in pharma since I came on board, and we have a lot of data reading out on that pipeline, including not least from our recently announced proposed acquisition of Tesaro in oncology just a few weeks ago. And we do like the stability of cash flow from both the consumer and the vaccines business, which is in part why we are announcing that we expect the separation to be within 3 years. But we do want to take some time to do that, in part because we've done it before. We know how to integrate joint ventures. We did it previously with Novartis. And we don't want the consumer business to be distracted around separation. We want them focused on a successful integration and delivery of operating performance. But also, we do like the cash flows in this near-term period as we invest strongly in our pipeline in the next wave of growth. But your point on vaccines is critical. The new company for GSK that will be focused on pharma and vaccines is going to be, as we are today, the world leader in vaccines. And this is a business that I think is a bit underinspected. We have tremendous growth. We just recently launched very successfully Shingrix, new shingles vaccines. Remember, 1 in 3 of us will tend to suffer from shingles, and this has had a tremendous start in the US and has great growth prospects internationally over the next few years for the company. And vaccines don't suffer from the same kind of patent cliff, and they also have very high barriers to entry as pharma does. So we do see that as a considerable cash flow contributor. But don't forget, in our pharma business, we're also today world leaders in respiratory. We have a big and growing HIV business with an exciting pipeline as well that's under development. So we do think at the moment, as we've pointed out today, that a separation within that 3-year period, but certainly not immediately, would be optimum and set us up for 2 stronger businesses, very importantly with the right capital structures, because that's what the separation also allows for, to invest in their future growth.